At his request, the name and image of the doctor who participated in IFI COVIDCon forums will not appear in this video presentation. He believes that a widespread public identification could put his medical license and practice in jeopardy from those who object to medical freedom and transparency. But rest assured, Dr. Anonymous, as we're calling him, is highly qualified to speak on the issues covered in this video. We base that opinion in part on his 3 decades of medical experience as a board-certified internist and pediatrician, as well as his care for over 1,000 patients with COVID.
In reviewing the last 3 or 4 years and asking what happened, in this presentation we're going to focus on 3 lies. We're going to focus on the lies about lockdown, the lies about therapeutics, and the lies about the so-called vaccine. My experience in this needs to be understood as a limited person of science, and I want to approach this with a great deal of humility, recognizing that I'm open to being challenged and especially encouraging civil debate. Unfortunately, there's been precious little of that. This presentation is for information purposes only. It's not meant to be used for medical advice. I want to acknowledge my wife, as well as others who've been outstanding in their guidance. People like Michael Jiden, Paul Merritt, Denise Rancourt, Claire Craig, very good scientists who've done diligent research. So let's take a look at how it is that we can expose a few lies. Lie number 1, lockdowns save lives. Lie number 2, there's no treatment for COVID-19. Lie number 3, the vaccine will save us. Let's talk about lockdowns save lives. There's really no data showing that lockdowns work. What you see with lockdowns is death, social and economic harm, negative effects on children, suppression of your immune system. You may recall in the early spring of 2020, there was an effort to lock down with the idea that this would flatten the curve on admissions to hospitals. But by the summer of that year, everything seemed to be kind of normal. But then in the fall, there was another really strong attempt to develop lockdowns again. In October of 2020, 3 people, Dr. Sinesh Gupta, Dr. J. Bhattacharya, and Dr. Martin Kulldorff put together a response in opposition to this lockdown called the Greater Barrington Declaration. And over the past several years, there's been nearly 1 million people who have signed on to this. And what they were proposing was an alternative way to address the most vulnerable people without destroying the economy. This was met with severe opposition by Dr. Francis Collins, who put out this notification writing to Tony Fauci. The proposal from these 3 fringe epidemiologists who met with the secretary seems to be getting a lot of attention, and even a co-signature from Nobel Prize-winning Mike Levitt at Stanford. There needs to be a quick and devastating published takedown of its premises. I don't see anything like that online yet. Is it underway? This is just one illustration of the tremendous censorship that occurred during this period of time by people at the very highest level of public health. Now, let's take a look at the justification for lockdowns. It's based on a supposition called asymptomatic transmission. That means essentially that somehow people could transmit the disease without having any symptoms. This, however, was never a forward driver of illness. The claim was that greater than 30% of people who were asymptomatic were capable of transmitting disease. Unfortunately, this rested on a very faulty test called the PCR test. Now, the PCR test detects the genetic material of the virus. And unfortunately, you can't tell when you detect that genetic material whether you're detecting a dead virus or a live virus, because you're just detecting the genetic material. In addition, this test can detect a very, very small signal and amplify that to 40 times that signal. And when you amplify this, it's like turning up the volume on an audio amplifier. You're going to hear a lot of noise, a lot of signals that are false signals. And in fact, there's over 30 papers that were written claiming that there was asymptomatic transmission, but their data relied on very amped up PCR tests. And in fact, the false positive rate for those tests was probably close to 90%. Okay? Now think about it. That means a large number of people who had no symptoms tested positive even though they had no disease. We also have to keep in mind that for the very first time that I'm aware of, we started to claim that a positive test equals a case. Now, when I see a patient in my office and they come to me with symptoms of the flu like fever, chills, muscle aches, and so forth, that is the kind of patient that I test. I don't test just any random person. I don't do a drive-by test, right? I don't say, come in my parking lot and get your nose swabbed, okay? And in fact, even if you don't account for the upstage sensitivity of these tests, you're dealing with a very, very high false positive rate just by doing that. So what we saw here was a deliberate misuse of a test. And the reason it's a lie is because people knew it. People knew about this. Okay, let's go on to the next lie here. Lie number 2, there are no treatments for COVID. Well, I think we could beg to disagree with that. So here you see early 2020 hydroxychloroquine, and then you see zinc and ivermectin and vitamin D. These were all readily understood early on in the pandemic. Okay, so let's take a look at hydroxychloroquine. What you can see here is that in 17 studies, you see a 76% lowering of mortality, and there's over 422 studies. Ivermectin, you see a 49% lowering of mortality in 51 studies. That's pretty good. How about vitamin D? 36% lowering of mortality in 67 studies. So, why didn't we hear about this? Well, let's just say people wanted to promote a vaccine, so-called vaccine. Let's talk in that regard about something called emergency use authorization. This is a statutory regulation that allows the government to put forward a product that has not passed the regulatory FDA process, but because of the emergency, allows us to use this product anyway. We saw that in the spring of 2020, Doctors Fauci and Collins and 2 other authors wrote in the journal Science that we should develop a vaccine to cover everybody and distribute it to every person in the world. Now, how do you do that with emergency use authorization? Well, emergency use authorization can only hold up if there are no readily available therapeutics, if it's the only thing you have is this so-called vaccine. So in order to ensure that the vaccine was approved through emergency use authorization, they had to discredit hydroxychloroquine and ivermectin. What they did with hydroxychloroquine was there were studies where they actually abused a toxic dose of hydroxychloroquine. And in the recovery trial and in the solidarity trial, you saw that up to 25% of the people in those studies died of hydroxychloroquine toxicity. So does that mean it's a bad drug? No, it means that it was set up to fail. Same thing with ivermectin. With ivermectin, the New England Journal study underdosed the drug, gave it for not a long enough period of time, didn't give it with food like it's properly supposed to be given, and so that too was a study designed to fail. Now let's talk about this. First of all, we need to recognize this is not a vaccine. Classic vaccines take weakened or killed viruses, pieces of viruses, or inactivated bacterial toxins, and incorporate them to stimulate your immune system to develop a response. This product instead is engineered using mRNA technology and is more properly called mRNA gene therapy. You may not know this, but in 2016, Moderna applied for a patent for a SARS CoV2 vaccine. They were not approved because the patent office said this is not a vaccine, this is gene therapy. However, by March of 2019, they actually had a patented approved so-called vaccine. Think about it, a year before the so-called pandemic. Now let's take a look at the molecular biology of this. And I'm going to be very simple in how I explain it because I want to make sure it's understood. So what you see here is the virus, which is covered with these spike proteins. And what the vaccine does is it takes the genetic material of the virus and incorporates this in something called a lipid nanoparticle. This is a fatty fat bubble, which allows it then to fuse with the cell. And then your genetic material then goes into the human cell, hijacks our own protein synthesis machinery to make these spike proteins. So what we're going to do is we're going to examine now in a minute the ways these components come together. But before we do that, we first want to talk about, well, what is the real need for this product? And to do that, we can look at something called the infection fatality rate. What you see here at the bottom for 0 to 19-year-olds is a 0.0003% fatality rate from COVID. This was back in the day with the bad variants, the Alpha, Delta, Wuhan. So that's only 3 children per million. In fact, even if you look at the highest risk group, 0.5%, which is equivalent to a bad flu, Let's take a look at safety now. Before the release of this product, Pfizer did a randomized controlled trial with 44,000, 22,000 in each group. The placebo group had 22,000, the vaccinated group, so-called vaccinated group, had 22,000. Well, look at this. In the vaccinated group, 21 people died. The unvaccinated group, 17 died. Now, how did that ever get emergency use authorization? What happened was in the original published study, they said 15 people died in the vaccinated and 14 in the unvaccinated. That's because they didn't count all the people who died during the study period. But if you do a forensic analysis that's, say, a retro-analysis of the data itself, you see that the data on many of these deaths was reported after the study ended, but the actual death occurred during the study period. So the real number is more people died in the vaccinated than the unvaccinated. Had that been published, they would have never received emergency authorization. What did this study show? It showed so-called 95% efficacy in what? Reducing mostly cold symptoms. In the vaccinated group, there was one person who died out of 22,000 from COVID. In the unvaccinated group, there were 2 people who died from COVID. So that's 100% effective, right? Because 2 is more than 1 by twice the amount. No, that's what you call a distortion. All right, let's look at the components of this product, starting with the spike protein. Interestingly, this former CDC director, Robert Redfield, now recognizes that the spike protein is immunotoxic. In fact, there's 1,000 papers or more showing the toxicity of the spike protein. In fact, you can take the spike protein, put it on a nanoparticle, give it to hamsters, and they all get COVID. So the spike protein is the actual entity of the virus that produces the disease. So, why would you make a product injected in people that make spike protein? Does that make any sense? Lipid nanoparticles have fat components that are actually toxic, and they circulate throughout the body, across the blood-brain barrier, and concentrate in the ovaries and the bone marrow. And then the mRNA, which as I mentioned before, is the genetic template for the spike protein, was a synthetic form of mRNA. And because of that, it lasted for at least 2 months, which essentially allows you to become a spike protein factory. And the other problem with this is that it frustrates the normal synthetic process of protein making, so you actually generate a lot of mutated proteins, which can be carcinogenic. Let's talk about basic immunology. By the way, if any of you here don't believe in God, but then study the immune system, you will believe in God because God made our immune system in an amazing way, and I'm going to give you a very concise view of what's going on here. There are cells which are called T cells. T cells are actually part of your white blood cell system, and they're activated by foreign protein fragments. What happens is your cells consume certain proteins and chop them up and present them on the cell membrane, and they're recognized by T cells. And if they're your own proteins, they're self-proteins, the T cell says, "Oh, I like you." However, if they're non-self proteins like this, they present in such a way that activates these T cells. And by activating the T cell creates a scenario which results in the destruction of those cells. So think about it. You're making spike proteins in your cells. Your immune system sees that as foreign protein, and it's activating the T cells, and then they destroy your own cells. Now let's take a look at that further on here. So this product is circulating through your circulatory system. So one of the first places to be attacked is the lining of the arteries. And so what you see here is the lining of the arteries in the brain here. And this brown represents the spike protein. And so you see all of this is incorporating into the brain circulation. Now you see heart muscle, normal heart muscle here. See, it's nice and beautiful and stranded, but now look at this. This is a patient who had the vaccine, and these black dots are these T cells. They've invaded the muscle of the heart, causing all this disruption of these cells and scar tissue formation. This is what we call myocarditis. We also see everything brown. Here is spike protein. So right here, this is the uterus. This is the placenta. You can also see now, because there's inflammation and irritation of the lining of the arteries, what happens is that promotes clot formation. Here you see the results of various autopsies secured by various surgeons and embalmers. And what you see, these long, very irregular clots, sometimes as long as 4 feet long, and they don't have the same consistency as normal clots. It's a very different material. They're like rubber. Now, here's another issue on safety. These products are contaminated. It's interesting, if you look at the product label, if you ever open a label to these vaccines, so-called vaccines, the product label is blank. They don't tell you what's in it, probably because they don't know what's in it. Now, there are 2 different manufacturing processes that were used in making this messenger RNA. One process used a DNA template, and it used it to make the messenger RNA. The other process used what are called plasmids, which are circular DNA components that are in bacteria, E. coli bacteria. In the clinical trials, this was the process that was used to generate the messenger RNA. In the mass distribution, this is what was used. First of all, you have to recognize that's an absolute no-no. If you're going to distribute a process, you need to trial. If you're going to distribute a product, you need to trial it for each manufacturing process you use. There were less than 200 people in this that were actually trialed, and this was the product that went out to billions of people. Now, let's look at this carefully. What's going on here is that you're taking a segment of the virus's DNA, you're putting it into this plasmid, and then the plasmid replicates and the bacteria replicates. You have these huge vats of E. coli bacteria that make then this messenger RNA. And unfortunately what happens is you're supposed to clean this up afterwards. But in the end, what happened was there was a lot of bacterial DNA that was left over, and that bacterial DNA from these things has shown up in the vials. It's been confirmed by several scientists. It's also been recognized by the FDA as well as Health Canada. They've acknowledged this contamination, and this DNA has the potential of integrating into your own DNA. Moreover, Pfizer, for some unknown reason, incorporated in their genetic sequence something called the SV40 enhancer, which is a product that actually promotes the transportation of this DNA into your nucleus. That is an absolute no-no, because once it's in the cell nucleus, then it can get at your own DNA and integrate into your own DNA. And I'm pretty sure people wouldn't have bought this product if they knew that it would make them genetically modified organisms. Okay, let's talk about myocarditis. Myocarditis is the inflammation of the heart muscle. CDC says, no problem, we've got this under control. It's rare and it's mild. Not the case. If you look at what's called subclinical myocarditis, which is myocarditis that you can detect by measuring cardiac enzymes, and you study people who've gotten the vaccine, 3.5% of teenage boys, 3.7% of women, 0.8% of men get subclinical myocarditis. That doesn't sound very infrequent to me. That's terrible. And now how about what happens after a year? For those who actually get myocarditis, we can image them and find 58% of them have persistent cardiac damage. That doesn't sound very mild to me or rare. Let's talk about turbo cancer. Turbo cancer is a phenomenon which we see where young people who normally don't get cancer are presenting with stage 4 cancers. This is pretty terrible. And you see most of these events are occurring right after the vaccine is distributed. So if you look at these malignancies, this is breast, brain, colon malignancies of nonspecific sites, malignancies of the skin. You see this spike in increase in the number of cancers, and even here now into 2022. Maternal fetal medicine issues. This product was never trialed on pregnant women. And yet somehow the American College of Obstetrics and Gynecology and the American Academy of Family Practice recommend this during pregnancy. Now, if you give this to a woman during the first 2 trimesters of pregnancy, your risk of abnormal outcomes goes dramatically up. The miscarriage rate increases by 6 to 26%. The stillbirth rate goes up 5-fold. There's a field cardiac disorder increase that's 6-fold, and abnormal menses are reported at 145 times greater normal rate for women who get this product. This essentially is an abortifacient. Let's take a look at something called the Vaccine Adverse Event Reporting System. If you want to look this data up, it's updated every month. 19,000 deaths from the vaccine. Now, this has to be understood in the context of what normally would get something off the market. Back in '75 when Ford was president, It only took 25 deaths from the swine flu vaccine for that to be pulled. Now, these reports are not spurious. Over 70% of them are actually given by healthcare workers. Here we see permanent disabilities, largely neurologic, miscarriages, heart attacks, 9,000 shingles. Again, an indication of how it's affecting the immune system. And if you look at the actual temporal relationships here, which you see, this is the incidence of deaths, and this is the timeline, this is day 8. 80% of these deaths are occurring within a week of the jab. This can only be explained by the vaccine. Now, some people will say, well, that's just an association, and that doesn't prove causality. So let's take a look at the methods used to prove causality. One method is called the Bradford-Hill criteria. And there's 10 criteria, and a woman named Jessica Rose published that all those 10 criteria match the criteria for causality. So we have definitive proof of causality for these events. Interestingly, the same criteria was used by the U.S. Surgeon General in the 1960s to show that cigarettes caused lung cancer. Let's take a look at other data that corroborates this. We can get data from the military. This is the Defense Medical Epidemiologic Database. A 2,000% increase in hypertension, 680% increase in multiple sclerosis, Guillain-Barré syndrome, breast cancer, 487%, pulmonary embolism. That's blood clot in your chest of 468%. And there's a list of at least 12 other conditions in this as well. Now again, we're looking at data here to corroborate. So we have multiple sources of data. We're not looking at just one isolated data set, which is quite important. And when you see corroborative evidence, that's also another indication of causality. This data is on what we call all-cause mortality. So you probably would agree that when someone is dead, they're dead, okay? There's not a lot of controversy about that. So that's one of the most definitive ways of measuring an outcome is to look at what we call all-cause mortality. And this study showed that worldwide all-cause mortality was about 17 million for vaccinated. So the vaccine killed about 17 million people worldwide, killed about 714,000 Americans. This study also showed that a fatality rate in greater than 90-year-olds, which are always the folks that are argued to have the most need for the vaccine, but in fact the fatality rates from the vaccine was 5%. Think about it, a 1 in 20 chance of dying if you're over 90 and you get the vaccine from the vaccine. Now this data has been corroborated by Ed Dowd, who used to be an analyst at BlackRock. He wrote a book called Cause Unknown, and they analyzed the data from the insurance industry. And it corroborated this association between giving the vaccine, which was required by many employers in the mid-2021 area, and the occurrence of a spike in deaths and in disability. Here we see also corroborating data on all-cause mortality from Germany. And you see that 2020, this is the era of COVID, right? Not a whole lot difference. In fact, some periods of time look like it's lower, but once you get into 2021 after the vaccine, or the so-called vaccine is given, you see this increase in excess mortality. Here we have athletes collapsing on the field. It's important to understand that this is measured in a period 2021 to 23. What we see is 1,996 people collapsing, 1,394 dying. This compares with the usual rate of only 25 per year of athletes dropping dead on the field. Now, this data comes from United Kingdom Health Security Agency data. And what you see here is a statistic which we call number needed to vaccinate. What that means is, in this case, how many people do you need to vaccinate to prevent one hospitalization? Turns out this stuff isn't really that effective, is it? For the 50 to 59-year-olds, you have to vaccinate over 43,000 people to keep one person out of the hospital. At the same time, if you vaccinate this many people, you're likely to have this many serious adverse events, including death. If you do this now for the 40 to 49-year-olds, you need over 92,000 people to vaccinate to keep one of them out of the hospital. At the same time, though, you're having serious adverse events in 116. Here with the younger group, you need 210,000 to vaccinate to keep one out of the hospital, and you're creating 263 serious adverse events. This is absurd. Not only that, it's reckless. The animal studies showed fertility problems, birth defects, and movement disorders. This is in data submitted to the European Medicines Association, which is the equivalent of our FDA. But look at what this expert, the senior editor of the New England Journal of Medicine, said. But we're never going to learn about how safe these vaccines are unless we start giving it. That's just the way it goes. This data is very interesting. The Cleveland Clinic studied over 51,000 of their own employees, and look what they found. This is cumulative incidence of COVID, this is days, and this is the number of vaccine events. So 0 doses, 1 dose, 2 doses, 3 doses, and more. And what you see for every dose, you get more COVID. So this vaccine actually suppresses your immune system and enhances your rate of getting COVID. Now, what about efficacy? Well, let's just take a look at the children's data. The FDA, in one of their meetings in June of 2022, recognized that for children under 5, there are preliminary, imprecise, and potentially unstable data on efficacy. And then they said there was really no efficacy. Pfizer said, if you look at the data for the 6 months of the 4-year-olds, there was a 2.6 times greater risk of developing COVID in the vaccinated group, and they had more severe disease. So why is this now enshrined into the CDC vaccination schedule? We went from an emergency use authorization, and now this material is enshrined in the pediatric vaccine schedule with a recommendation that beginning at the age of 6 months, children should get this shot. And of course, you're seeing Walgreens, all these other places promoting it, get your COVID shot, get it every year, and so on and so forth. So if you had a baby crib that was defective and injuring kids, you have this thing called the consumer protection laws, right? You would recall that company would be required to recall it. This contamination warrants a recall. In fact, in the state of Florida, they say no more of this stuff, right? But these vaccines, not only are they on the approved vaccine schedule for children, but there will be a use of this technology using the messenger RNA platform to develop future vaccines. And most likely your classic vaccines will probably be developed through this technology. So we need to remember that for God's temple is holy and you are that temple. And we need to remember bodily sovereignty. We need to remember that our bodies are the place where the Holy Spirit dwells. The Apostle Paul, speaking to Timothy regarding the household of God, said, "The church of the living God is a pillar and buttress of the truth." The task of the church is to help us think wisely and avoid being deceived. We need to care for the brokenhearted. We have lost people from COVID. People have been experiencing isolation. There's been a medical apartheid where families, schools, businesses have been divided over these things. Many people have deep regret for getting the jab. This church needs to be a haven to welcome folks and care for folks. And we need to resist this tyranny or become enslaved.
Why didn't more doctors say anything about what was happening with the COVID response? Why didn't they cry foul play?
I think it's important to understand that physicians are trained using an apprentice model. We trust our mentors, we believe them, we follow their lead, we look to academia as the place for securing somehow independent information. But what's happened in medicine is it's become more and more corporatized. And so with this corporatization, the model has become a business model, and it's about cranking out visits. I won't name the name of the company, but a couple patients came to me and said they gave me 7 minutes in my visit. With that amount of time, there's very little time to be reflective. As a result, we've been looking to the experts. But experts, really expert opinion, is one of the lowest levels of scientific evidence. In addition to this, for a long time, the journals have been problematic. There was a woman named Marie Angel who was the senior editor in the England Journal of Medicine. She resigned after 20 years as editor. She resigned in the early 2000s, realizing that many of these publications were not to be trusted. Yet, if you have a study from the New England Journal of Medicine, it's supposedly peer-reviewed, it is believable by most physicians. Most physicians don't know how to read the papers, and they were subjected to the same kind of military-grade propaganda and censorship as the general population. And of course, if you're working in a corporation and you're under the thumb of a medical director and you're saying, you got to do all this, then you're either going to do it or you're going to lose your job. So I believe this is why. Unfortunately, many people trust their doctors, and it seems paradoxical that the doctors would do this. I don't think most physicians did this out of malintent. I don't think they were trying to harm their patients, but I do think they didn't know what this was about.
Where did COVID come from?
In order to understand the answer to this question, we need to understand something called gain of function. Gain of function is when you engineer a pathogen to become either more pathogenic, more contagious, more resistant to your immune system, or more resistant to a vaccine. Now, in the late 1990s, Ralph Baric engineered a process which is called cross-species transmission. So he was able to figure out a way to transmit this virus from one species to another. And eventually this project resulted in a bat coronavirus being successfully able to infect human tissue. Now that, believe it or not, is what SARS CoV2 is. That project was published in Nature Medicine in 2015. Okay? So that's pretty important to know because SARS CoV2 didn't just appear. Now we call it COVID-19, but the virus name is actually SARS CoV2. It didn't just appear out of the blue in 2020. It was actually published in 2015. Now, what happened soon after that was there a variety of ways that people tried to upgrade the pathogenicity of this virus. So in 2016, Moderna applied and received a patent that essentially engineered this virus to be pandemic ready. And the way that looks is this: there's a sequence, the building blocks of this messenger RNA. We call them nucleotides. There was a sequence of 19 nucleotides that Moderna engineered into the virus to make the virus more contagious. That same sequence, which was published in 2016, appears later in the so-called SARS CoV2 virus in 2020. Think about it. That was a sequence that appeared in 2020. Now, the probability of that occurring by chance is 1 in 3 billion. Okay? So initially there was an attempt to cover that up, and there were supposedly scientists that signed on to this idea that it came from the wet market. We don't have evidence of that. Instead, we have molecular evidence of the engineering of it.
I would like you to weigh in on how some churches in America were willing to surrender some of their freedoms during COVID. What lessons can we learn from that?
So some of you may know Francis Schaeffer. He was a philosopher theologian. One of his addresses where he gave at Notre Dame, he said basically that Christianity is not about religious truth, but about total truth, truth about everything. I think that we have to understand Christianity in that respect, and we need to strive to discern the truth, to know the truth, to love the truth. But there's a problem with the truth, and that the truth divides, and most people are conflict averse, so are pastors. If you really want to get to the bottom of things, you're going to have to deal with some degree of conflict. And conflict is inevitable, right? I'm not talking about physical conflict. I'm talking about disagreement on things. So what you need to do is figure out a good way to work through conflict. But I think many churches believe that any sort of conflict was disruptive to the unity of the church. And as a result, people were not interested in looking and not interested in hearing. There was a willful ignorance and also a great silencing. Well, that's behind us. COVID happened, and now we're moving on. And so in the course of all that, what we have to recognize is that we are basically disobeying the commandments of God by ignoring this conversation. Especially, this is a conversation which is about caring for our neighbor. Now, it turns out, oh, by the way, in late 2020, there were over 8,000 church leaders that signed on to promote this product, saying this is the way we love our neighbor, okay? So there was a fair amount of coercion, essentially using the trusted advisors, co-opting them, classic strategy for public health. And I think there was a violation of several commandments, okay? First commandment, we substituted God the Almighty for a God of safety, right? What about the third commandment? The name of God. Don't take it in vain. What happens when you take your genetic code and disrupt it? Here you have imprinted on that the image of God. Certainly the sixth commandment, thou shalt not kill. I mean, many admonitions in the Old Testament talk about even how it is if your neighbor's donkey is not doing well, or your enemy's donkey is not doing well, go out and help the donkey. Or if you construct a roof on your house, put a fence around it. Okay? So there's clear evidence of that understanding of the sixth commandment to care for your neighbor, and the ninth commandment, you need to tell the truth. All these commandments were violated. I think also much to the message that Illinois Family Institute promotes about how we shouldn't be dualistic in thinking about politics and the role of the church. The church assumes that this was just a medical thing. We're the church, we're over here, it's church ecclesia. That medical stuff, that's for the church organic. We don't get involved with that. Yeah, but what are we trying to do if we're shepherds of the flock? Isn't one of the primary roles of the shepherd to protect the sheep? Instead, we were afraid, and we need to remember fundamental doctrines first about creation. We're created in the image of God. What does that say about bodily autonomy? What does that say about how we were to protect the temple of the Holy Spirit, which is our body? What about the doctrine of original sin? Shouldn't we have some skepticism about certain things? We need to recognize the antithesis divides every human institution. It divides those sacred journals. It divides the sacred field of public health. So we have to realize and be discerning. And I think that Christ is not abandoned his bride, but it might be that the bride might be exiled to Babylon if we don't change our ways.
Let me ask you a follow-up question. What can we learn from churches that challenge the dictates of authorities during COVID?
I think we have to realize that when we love our neighbor, we first of all have to tell the truth, right? That's what loving our neighbor means. When you look at Ephesians 6, it talks about how the battle is not against flesh and blood, but the powers and principalities, and we are therefore to put on the armor of God. What is the first piece of the armor? It's the belt of truth. So if we're going to equip the saints, we need to start with the truth, and we need to work hard to discern the truth. The truth isn't always easy, okay, but we have to approach this with a spirit of charity, curiosity, humility. And if we can do that, we can love our neighbor in the right way by working to find the truth and helping people do the right thing.
Now my final question. What about the mask? Are they effective?
They're pretty good at helping people rob stores. They're pretty good at keeping spit out of the surgical field, which is what they were designed to do. So if you look at the surgical masks, the pore size, the cross-sectional area is 10,000 times the cross-sectional area of the virus. So that's like trying to keep a gnat out of a chain link fence. So we have to recognize that masks are actually considered medical devices. So first, with a medical device, you look at efficacy, they're clearly not efficacious, unless you look at the very sophisticated N95 masks. But even them have to be fitted, and they aren't very protective either. So efficacy is not there. How about safety? Well, if you have this mask over your face, guess what's happening? Your carbon dioxide level is increasing, and within 15 minutes, that exceeds the OSHA standards for carbon dioxide. What does that do about brain fog, okay? Also, you're rebreathing your pathogens, okay? And long ago, over a decade ago, Cochrane, which is one of the best scientific publishers, produced evidence showing that masks do not work for respiratory viruses. I encourage you to share this information to help equip the saints and to be in prayer. And remember again that this information is really meant for information purposes, not clinical advice. Thank you.